Welcome to the Explainer. Imagine this scene for a second. The doors burst open, alarms are absolutely blaring, and anxious people are rushing in from every direction. The emergency department is literally the definition of a high-stakes, chaotic environment. But, amidst all that intense noise and unpredictability, there's actually a silent, strictly structured system quietly at work.
And that brings up a really tough question. When a dozen distressed patients arrive at the exact same moment, how does a hospital decide who lives and, well, who waits? We desperately need a system to sort through all that chaos. That calm center of the storm is what medical professionals call triage. It's essentially a sorting process that utilizes critical thinking and a very standardized set of guidelines. It's exactly how experienced nurses quickly determine the severity of presenting problems, process patients into categories, and efficiently assign the right human and medical resources. Basically, it brings rapid order to unscheduled emergencies.
So, let's lay out our clear roadmap for this explainer, acting kind of like a triage nurse bringing structured order to our time together. We'll be covering sorting the ER chaos, meet the triage nurse, the critical first look, the color-coded lifeline, the triage sieve algorithm, and finally, test your triage skills. All right, let's dive right in.
Section 1. Sorting the ER chaos, bringing order to the unscheduled.
Now, the reality of a crowded hospital waiting room is super intense. Patients are anxious, distressed, and they're presenting terrifying symptoms rather than clean, textbook diagnoses. So how did the life-saving protocol to handle this even evolve? Well, triage actually has military roots. It was originally used to quickly sort wounded soldiers right on the battlefield. As civilian emergency departments started getting way more crowded with unscheduled patients, triage was introduced to hospitals in the early 1960s. And the protocols have only grown more sophisticated since then, with major milestones like the 1999 publication of the Canadian Triage and Acuity Scale. That gave us the comprehensive 5-level framework that heavily influences the modern systems we use today.
And this quote absolutely hits the nail on the head regarding why a rigid system is required. Not all patients are as well as they appear, and not all patients are as sick as they think. Look, it's just human nature to panic, right? Which is exactly why objective medical sorting has to override a patient's personal perception of their own emergency. Section 2. Meet the triage nurse, the eye of the storm. So, who is the ultimate solution to all this ER chaos? It's the highly trained healthcare detective sitting right at the front desk. A great triage nurse isn't just checking boxes. They're applying an intuition built from years and years of clinical knowledge. They must be able to make decisions incredibly fast, prioritize effectively, and maintain absolute patience. They work exceptionally well under pressure, and above all, they act as a patient advocate. These specific traits are exactly what allow the nurse to navigate life-or-death scenarios with such calm authority.
Section 3. The critical first look. Seconds that count. Let's look at the exact cognitive process that happens the second a patient walks in. The nurse performs an across-the-room assessment using a rapid, sequential process known as ABC. First, airway. They're checking for obstructions or choking. Then breathing, looking for severe difficulty or cyanosis, which is a bluish skin tone. Next is circulation, assessing for signs of shock, like cold extremities or a weak, rapid pulse. And finally, disability, noting any altered consciousness. This process brilliantly illustrates how immediate life threats are identified. And honestly, the most staggering part? A veteran nurse completes this entire initial sweep in a mere 3 to 5 seconds. Literally just a blink of an eye. Section 4. The color-coded lifeline. Tagging for survival. Okay, so once that critical first look is done, the nurse translates their assessment into a universal physical system. Notice how these colors create a kind of rhythmic visual anchor for the whole emergency department. Patients are sorted into very distinct categories. Red is priority 1, immediate, meaning there's a serious life threat requiring intervention within minutes. Yellow is priority 2, urgent. Green is priority 3, delayed, for minor injuries that can safely wait. And black indicates a patient is dead or deceased. This color-coded lifeline instantly communicates urgency to the rest of the medical team without a single word needing to be spoken. Section 5. The triage sieve algorithm, the logic of survival. Now, while the nurse relies heavily on intuition, in mass casualty situations, they're actually backed up by a precise mathematical algorithm known as the triage sieve. It all starts with one super simple question. Is the patient walking? If the answer is yes, the sieve instantly filters them out as a delayed green tag and directs them to a survivor reception center.
This is huge because it ensures critical resources are reserved for those who are incapacitated. But what if they aren't walking? Well, the algorithm then looks at breathing and pulse. And the magic number to remember right here is 120. If a non-walking patient has a normal breathing rate, but a heart rate greater than 120 beats per minute, it's a major indicator of shock. The algorithm demands they become an immediate priority 1 red tag.
Section 6. Test your triage skills. Make the call. All right, I want to step back for a second and invite you to jump directly into the shoes of the triage nurse. We're going to look at 2 real casualty scenarios from our source material. Here's our first one. Casualty A is a 56-year-old male passenger from a bus accident. He's walking around. He has a fracture to his right arm, his respiration rate is 24, and his pulse is 100. I'll give you just a second to process those vital signs against the rules you just learned. Challenge yourself to make the rapid assessment here. What is Casualty A's triage category? Is it red, yellow, or green? Okay, lock in your answer. Now, immediately pivot to a more severe scenario. Casualty B is a 48-year-old female. She is trapped on the bus with an abdominal wound. Her respiration rate is 34 and her pulse is 100. Push yourself to apply the ABCD rules and that mathematical algorithm we just talked about to this trapped casualty. What color tag does she get? Let's go ahead and reveal the answers side by side. Casualty A is green or delayed. Why? Well, because of that very first algorithm question, he is walking. Despite a super painful broken arm, he can safely wait. Casualty B, on the other hand, is red or immediate. She is not walking, and crucially, her respiration rate is 34. Anything over 30 demands immediate priority 1 intervention. Now, we took a couple of minutes to walk through that logic together, but a highly trained triage nurse makes that call almost instantly. Which leaves us with this final thought for you to ponder. Armed with the ABCD assessment, the color-coded tags, and the mathematical sieve, could you sort life from death in 5 seconds? Thank you so much for tuning into this explainer. I really hope you leave today amazed by the high-pressure precision of medical triage. Keep learning, and I'll catch you next time.